In the veterinary hospital, the proper handling of sharps and sharps containers is vital. Practicing safe handling techniques of these hazardous items will greatly reduce the risk of personal injury. In this video, we will discuss what you need to know when using and disposing of sharps. First, let's discuss the proper handling of sharps. OSHA considers sharps to be items such as hypodermic needles, suture needles, scalpel blades, microscope slides and covers, and hematocrit tubes. Contaminated sharps should not be bent, recapped, or removed unless there is no feasible alternative. If you need to recap a needle, you must use a one-handed technique or a mechanical device. When dealing with broken glass, never pick it up by hand. Always use tongs or a broom instead. Sharps should be disposed of in an approved sharps container immediately or as soon as possible after use. Instead of putting yourself at risk by recapping a needle, dispose of the entire syringe in the approved sharps container.
It is so easy in veterinary medicine to inadvertently poke yourself in the finger or cut yourself with something sharp because we're working with sharp items all the time. If you do puncture your skin, most important thing to do is immediately soap and water, clean it really thoroughly, and tell your supervisor.
Approved sharps containers should be puncture resistant and leak proof on the sides and bottom. Sharps containers should be labeled and color coded in an appropriate manner. Sharps containers should be located in every area of the hospital where sharps are found, and as close as possible to where sharps will be used. Sharps containers should be kept upright and never overfilled. When the container is full, make sure the lid is closed and securely in place before moving.
Probably the bottom line for when you're working with a sharps container. Something goes in, never take it out. If you're past the full line because somebody just wasn't paying attention, don't try to push it down with your hand. Get something that's solid, inanimate, push it down that way so now it's safe, and seal it. Not sure how to handle that particular sharps container? Ask your supervisor.
When a sharps container is full, place it in a secondary container that is labeled and color-coded in an appropriate manner. Sharps containers that have been contaminated on the outside or may leak should also be handled in this manner.
When working with sharps, it's so important to keep in mind you're protecting your health, the staff around you, and the animals. Following directions for a sharps container appropriately, following the OSHA regulations is essential for maintaining a healthy, happy workplace.
As a veterinary professional, you will be using sharps and sharps containers on a daily basis. It's important to have a clear understanding of how to safely handle these items. Any questions regarding the handling and disposal of sharps can be addressed by contacting OSHA.